in Santa Maria del Carmine because a great step forward in pain therapy has been made in Roverito, in particular for chronic back pain. The anesthesia and resuscitation department is the protagonist. Let's see the service. Back pain, herniated discs. There are many who suffer from it, and in some cases, nothing can be done even with drug therapies.
It is only at this point, when drugs are no longer enough, that pain therapy interventions are entrusted to us, and it is in Roverito, in the anesthesia and resuscitation department of Santa Maria del Carmine,
which just now have been made great strides thanks to the introduction of a medical device called ZINEU, a Korean technique designed to deal with complex pathologies, such as restless legs syndrome, back surgery failure, canal stenodes, and intervertebral disc herniation. Dr. Massimiliano Raggi was the first to use this technique in a public hospital in Italy. But what is it that makes the action of this procedure so decisive?
The peculiarity is that it is extremely less invasive than the conventional technique of epiduroscopy, and through this balloon we are able to reduce any inflammatory or scarring processes that form within the periodal canal. Once we have managed to free this obstacle, we are also able to infuse an analgesic mixture to reduce the
What are the pathologies in which you intervene with ZINEU and Roverito?
inflammatory processes, absolutely, and fundamentally post-surgical processes, i.e. disc hives, which physiologically form scars. But in some subjects, these scars form inflammatory and adhesion processes that stretch the nerve roots and generate pain.
The department is mainly engaged in intensive care and surgical anesthesia and more, but the analgesic therapy part has greatly increased in recent years.
Our scope is to care.
Chronic, non-oncological pain mainly. So all patients who have significant pain that compromises normal daily activity then turn to a pain therapy center such as the number is ours for relief.
and are the number of patients with chronic pain also increasing?
The number increases because there is an increase in pathologies affecting the spine, which are difficult to treat, which are very disabling, and which also require specialized activities.
Pain therapy also needs teamwork where the presence of nurses becomes essential, who are currently a bit scarce.
They are the nurses of antiagic therapy. They are nurses of the anesthesia and animation department. And they do a great job, both organizational, but also support in the operating room during the procedures.
There is a large team. Do you need reinforcements?
There is always a need for reinforcements, especially at the moment, but they are well contacted by a good group.